Aboriginal cultures and beliefs are inherently tied to the land they have inhabited for thousands of years. Before European colonization, they were self-sufficient hunting and gathering communities. Prior to contact with European settlers, they developed intimate knowledge of their environment and adapted their skills, technology, traditions, and customs to live in harmony with their surroundings. Embedded in Aboriginal cultures is a deep respect for the land, plants, and animals that they depended upon for their survival. They believed that these were gifts from the Creator, therefore it was fundamental to their well-being to live in harmony with nature. Their hunting and gathering traditions demonstrated their understanding of the need to maintain harmony and balance so that there would be enough resources to pass down to future generations. Elders used oral storytelling to pass down their beliefs and traditions to the younger generations. Cooperation and sharing were fundamental to survival in their natural environment. Family and community were vitally important to the Aboriginal people. Traditionally, the village or community shared in the responsibility of raising children, caring for one another, and ensuring continued existence. Aboriginal people share a holistic perspective on health. This means the body, mind, and spirit are interrelated and must be addressed together to ensure complete wellness. In the 1500s, European settlers began arriving on the North American continent. The profound changes that resulted from their arrival had a negative impact on Aboriginal health. The decline in health can be attributed to four main events. Infectious diseases. Measles, smallpox, influenza, typhoid, tuberculosis, and sexually transmitted diseases spread rapidly and killed thousands of Aboriginal people who had no previous exposure to these illnesses and therefore no immunity to fight them. The arrival of European technology. Guns, along with the demand for fur and animal skins, rapidly reduced the animal population which Aboriginal people depended upon for food. As a result, starvation was more widespread. Becoming wards of the government. As European settlement expanded in the 1800s, the government policy toward Aboriginal people focused on assimilation. Various acts defined Aboriginal rights and the terms and conditions for their access to services and inclusion in Canadian society. For example, under the Indian Act of 1876, First Nations people became wards of the state, which meant that the government became the Aboriginal person's legal guardian and was thus permitted to make decisions on their behalf. Became disenfranchised, which meant that they lost their First Nations identity if they earned a university degree, joined the clergy, or military. Had Western forms of government imposed on them, which effectively excluded women and elders from positions of leadership. Were subject to private land ownership rules, which meant they were no longer able to live a traditional nomadic lifestyle, but had to make a living on reserved pieces of land. Between 1871 and 1921, the Canadian government negotiated a number of treaties with various First Nations to allow the government to settle and develop the land in the Canadian West and North. The major outcome of these treaties was the creation of reserves. In exchange for large tracts of land, the Canadian government provided First Nations with specific or reserved locations for their settlement. 45 reserves were created in Alberta. First Nations people of Alberta, whose traditions were steeped in a nomadic hunting and gathering lifestyle, were relocated to reserved lands and expected to develop agricultural skills. The Canadian government created residential schools to provide a basic level of education to First Nations children. These schools officially operated in Canada between 1831 and the late 1990s. They were church-operated and attendance was compulsory. In order to attend, children were forced to live away from their homes and reside at the school. They were forbidden to speak their language or practice their customs while at school. Psychological, physical, and sexual abuse was common. Outlawing of traditional ceremonies. During the late 1870s until the 1960s, it was illegal for First Nations people to practice their spiritual ceremonies, including the sun dance, sweat lodges, and feasts. They were prohibited from wearing traditional clothing. Many other ceremonial items and regalia were confiscated and sold. Traditional dances were only allowed as shows for non-Aboriginal people. These four historical events are seen as contributing factors to some of the health inequities Aboriginal people currently face. The loss of their land base, which enabled them to hunt, trap, fish, and gather food, has changed their dietary habits. This is seen as a contributing factor to the Aboriginal population's increasing obesity and diabetes concerns. The relocation to reserves and the multi-generational span of the residential school system contributed to the disintegration of families, communities, and traditional knowledge. An awareness of Aboriginal culture and the historical events impacting Aboriginal people's health provides an important layer of context in determining how to provide culturally competent care. In the next segment, we will examine culturally safe strategies for engaging with Aboriginal patients, clients, families, and communities.